and she is adjunct professor in the Division of Pediatric Anesthesiology at the Emory School of Medicine. Welcome, Dr. Agoston. Dr. Rachel Ammirati is an assistant professor and assistant vice chair for Faculty Development of New Initiatives, Department of Psychiatry and Behavioral Health Sciences at Emory University School of Medicine and Grady's Infectious Disease Program. Welcome, Dr. Ammirati. Dr. Justin Palanci is an assistant professor at Emory University School of Medicine, Department of Psychiatry and Behavioral Health Sciences. Welcome, Dr. Palanci. Dr. Palanci is also medical director for Assertive Community Treatment Program at Emory at Grady Memorial Hospital and the co-director of the Open Dialogue of Atlanta. Welcome again, Dr. Palanci. Before we get started, I would like to go over the format of the webinar. I will be asking the discussion a list of questions. We also plan to save 10 minutes at the end of the webinar for the discussants to answer questions submitted by the audience. Your mics will be muted throughout the webinar, so please submit your questions through the chat box. Let's get started with the first group question. Question 1, in your opinion, how has COVID-19 affected your clients or patients?
Can everybody hear me?
Mm-hmm. Yes,
okay.
You can.
Yes.
All right, great. First, I want to thank you for having me to this discussion. I think COVID-19 has affected our clients in a variety of ways. One being they seem to be very anxious and concerned about their health and the health of their loved ones, which is causing anxiety, especially due to the uncertainty of what's going to happen with the coronavirus. Secondly, I've been seeing depression symptoms being exacerbated due to this loneliness and the social distancing. So we've been seeing a lot of depression as well as substance use, similarly because of stress and isolation, and then also some job loss and insecurity, financial stressors. So I would say those are kind of the four, the biggest concerns that I've seen from my patients due to the coronavirus.
Can everyone hear me okay?
Yes, we can hear you. We can hear
Great.
you, Dr. Ammirati.
So, so I am based clinically at Grady Disease Program, and I think it's important to note that all of the individuals I work with are adults who were already dealing with a major infectious disease, that being HIV. And it's been sort of interesting. I think, I mean, like Dr. Lamis was saying, I've seen a range of responses. I think for some of our patients, their take on things is, I've already been living with an infectious disease. It's a pretty serious one. I'm going to be able to handle whatever, the current COVID outbreak throws at me. For other patients, it's just one more major stressor that they don't feel prepared to deal with. And so I've seen both sort of resilience and also just additional stress. It's been interesting too, I think for a lot of our patients, as soon as the news started to spread that the outbreak was here in the U.S., hunkered down. And our referrals within our clinic, so I work in a mental health clinic within a larger specialty primary care clinic, our referrals are actually down. And that's probably because patient care in general has sort of gone down because, like I said, our patients sort of view themselves as vulnerable, and they all, not all, but many of them have just kind of decided to withdraw for now. And it's sort of like, okay, I'm gonna withdraw from the world for a little while. I'll see you guys later because I know I'm vulnerable. and I'll let you know if I need something. And for that reason, we wonder if sort of down the road, as things start to sink in more and we start to try to resume some semblance of a new normal, if we'll actually be seeing more patients seeking out mental health services.
Dr. Agoston or Dr. Palanci, would you like to comment?
I mean, I can go ahead. So I think the situation is a little bit different for kids. I specifically, well, some of my patients are chronic pain patients, and a lot of their pain seems to be exacerbated by stress at school. So not having school is really a blessing for them. They don't feel the need to be as high achieving and get perfect grades, and the level of stress is actually much lower for them. I've heard from some of my colleagues that do outpatient work that their pain patients are actually doing so well they don't really need many appointments, or have just been having basically no pain. Then there's, the rates of, accidental injuries have been down, at least the ones that I see in the hospital here. In general, kids don't seem to be too scared of COVID. I think the message out there is that, it's not really affecting kids as much, and parents are telling kids that, so they don't seem that scared. The one thing that is happening is there are suspected higher rates of abuse that are going on that are related to kids being at home with their parents and the parents being stressed. So our ER is seeing some more patients coming in with abuse, and parents are also bringing kids in with behavioral issues. The actual reported rates of abuse, I think, are down because schools often are the ones to report that abuse. And so if you look at the numbers, it actually might be down, but I think everybody seems to suspect that there's actually more abuse going on right now because the parents are very stressed. There's also suspected high rates of domestic violence, so kids are witnessing some of that. And so I do think that there definitely needs to be more behavioral health services for a lot of these kids after this is all over, because it is affecting them, maybe not in a direct way where they're scared of the virus or having a lot of anxiety around that, but the kind of secondary effects or the primary effects on the parents have the secondary effects on the kids.
That was great, thank you.
Yeah, so good morning, everyone, and also thank you so much for having me here today. It's a pleasure. So I'm speaking really from my role as medical director of our ACT program, and for those who don't know, the Assertive Community Treatment Program serves adults with severe mental illness, mostly in the community and sometimes in the clinic. And we're a staff of more than 40 professionals, ranging from nurse practitioners to mental health techs and nursing and other services. So I actually thought it would be good to bring in my colleagues' perspectives on this question. So I surveyed our group, and here are some of the responses I got. I sort of clustered them by topic. So just to echo what some of my colleagues on the panel have already said, certainly an increase in anxiety. Clients are more hesitant about having me come into their homes. They're anxious and don't fully understand what is happening or why. They're paranoid that this is a way to control the population. They're having increased fear. We're also seeing interpersonal changes and challenges. They aren't as welcoming or talkative. They seem more hurried, not as open to talk to us when we have masks on. We've seen some increased family conflict and interpersonal difficulties with people sheltering and at home together. And in some cases, people have experienced a loss of family support. We're seeing the impact of isolation with limited social engagement activity, an increase in boredom, less to do with many of our patients attend day programs, and with those being canceled, there's just more idle time, which has led to things like an increase in substance use for some and an increase in weight gain for some as well. We've certainly seen a change and an adjustment in resources. Folks who have lost their employment folks that are feeling the stresses of a lack of resources, including food or their ability to pay rent or having their own PPE to use when they need it, and also navigating and understanding and utilizing the resources that are available to them in this stressful time. But it's also not all negative. I also wanted to point out some positive things that our staff have seen, which included things like some are taking great strides at wanting to better themselves. Some are more engaged and seem more interested in their treatment during this time. Some have been experienced as more relaxed when speaking over the phone and seem to actually be able to open up more easily over the phone. And there have also been instances where personal care homes, which many of our patients reside in, have stepped up and provided more activities within the home, given the fact that day programs are canceled.
Well, that's great information. Before I move on to the next question, would anybody else like to comment on this one?
Yeah. I guess one other thing I'd add is I spoke with some of my medical colleagues as well, and something we're noticing too is our patients are asking us a lot if we're okay. They seem more concerned about us than ever. And we think it's probably because partly, right, they know we're on the front lines. They know that many of us, and particularly my medical colleagues, are to some degree in danger at times because of the work that we do. I also think though they're asking because they're scared about losing us and sort of wondering, you know, what am I going to do if I don't have you in my life anymore? But we've all, both mental health providers, primary care providers, we've all been getting that question a lot. Just how are you doing? Are you okay?
That's a very good point. Very good point. Which leads us right into question 2, which is how has COVID-19 affected your practice? And I would add to that, affected you in your practice.
Well, the main way it's affected my practice is everything is pretty much moved to telehealth. So, which really is a big deal for my patients at Grady, because one of the biggest challenges was for them to get to their appointments. A lot of them have financial difficulties. They're not able to pay for transportation. So now everything is moved to telehealth, and it's actually been very interesting that they're showing up to their appointments much more now because it's more accessible through Zoom. So telehealth is definitely, it was slow to get going, but now that it is going, it's been really effective, and most of the patients show up to all of their appointments.
Other panelists like to comment on that?
Sure. I know Dr. Palanci and I are also based at Grady. It's the same for us. Although on the one hand, like I said, a lot of our patients are sort of withdrawing and hunkering down right now. Those who are still engaged with us are not no-showing as much. And I do think that this is a bit of a silver lining in the midst of COVID. COVID sort of forced us very quickly to turn to telehealth. We had been talking about using telehealth for a while. And then of course, when you start to talk about telehealth, you start to think about potential ethical concerns, logistical concerns, and this has just forced us to move. And our patients, for the most part, like I said, those who are engaged with us are liking it and able to engage with us more. It's not all easy though for a lot of our patients at Grady because they do struggle financially. A number of them do live in situations where there are a lot of other people. So sometimes it can be tricky to navigate privacy issues. So that does come up as well. But I would just add before my colleagues speak, is honestly, I'm providing a lot more support to my colleagues right now. I think I feel much more like part of a system. And a lot of my colleagues who are truly on the front lines, they're stressed. And so we've been doing things to try to support them more than we normally do. We started something called a virtual break program, where weekly we provide some programming for staff and the providers to try to give them a break, because we know people are really stressed. So that's been a big shift, is supporting my colleagues alongside supporting patients.
I can speak. So I'm all inpatient, covering Scottish and Agoston, but I was actually supposed to be covering the outpatient clinic as well, but our outpatient clinics were canceled, but we haven't been approved yet to do telehealth. So I haven't been doing anything outpatient, although some of my colleagues are making phone calls. I'm still required to go into inpatient, which was a little bit nerve-wracking at first. We moved a little bit less quickly than the adults hospitals that were seeing a lot of COVID patients in terms of just universal masking, and now we have that, so I feel pretty safe. But it was definitely an adjustment, and there's a lot of challenges in terms of building rapport, in terms of like I was standing in the doorways for a lot of patients, and so there's questions about like HIPAA and making sure no one's overhearing the conversation, but I also didn't want to put patients at unnecessary risk if I wasn't wearing a mask. And so I actually said I wouldn't see any patients in person that were immunocompromised, and administration was okay with that. So I've been making a lot of phone calls to patients in their rooms, which has been going pretty well. Like Dr. Ammirati, I actually have been doing a lot of staff support. So I have some iteration of like an emotional support group, teaching 4 days a week now. And so that's been very rewarding to be able to be there for the people who are really working with those COVID patients and who are experiencing a lot of that uncertainty over feeling, worried about taking home the virus to their families and balancing their families and work. And so I've felt like, I've been able to help some, even though sometimes because we haven't been seeing, like we haven't really been able to help as many people as we could because of some of the delays in being able to reach out to patients.
Thank you, Dr. Agoston. Dr. Palanci, did you want to comment?
Sure, yeah. So, our ACT program is an intensive service. We're usually seeing our patients 3 to 4 times a week, face-to-face in the community. With this, we have adjusted to more of a telehealth-based model, but we still make every effort to see each patient in our program face-to-face once per week. And so that's certainly been a shift and sort of goes in line with what my colleagues have also shared. And then I also took the approach with this question as well to sort of get feedback from my colleagues in the program. So just like with the patients, we're seeing an increased sense of anxiety, a feeling of uncertainty with who may or may not be affected due to the spreading by people who are, asymptomatic or pre-symptomatic, visiting areas, going into spaces, causing a good deal of anxiety, a sense of fear for our staff's own health and safety and well-being, despite taking as many precautions as we can. Some challenges in assessment, folks feeling like sometimes they're not able to be as thorough as they want to be because they are hesitant to stay in homes for too long or longer than necessary. At times feeling like they can't get as close to our patients as they would like in order to complete a thorough assessment, and that they feel like it's harder to read the patients when they're wearing a mask. A sense of isolation, feeling like, the reality is that not spending time with coworkers in the way that we are used to doing. But again, there have been some positives that have been pointed out, like feeling that this opportunity has allowed some of our staff to learn better how to communicate via technology, an opportunity to teach clients new skills, like teaching them about how to use Zoom and other technologies so that they can connect with us in new ways. Someone shared they've had the realization that patients have more resilience than they previously had thought, which I think is a nice sentiment. Do not take anything for granted, which I think is something we can all benefit from holding that thought in our minds. And with folks, staying at home or sheltering in place more, it's actually easier for us to reach them and find them. And we seem to at times be having more contact with family members. So there's been a mix of positives along with the challenges.
Thank you for that. That was very interesting information. And I agree. I think this pandemic has caused a mix of feelings and also effects. And with that, I would like to move us on to our individual. First, Dr. Ammirati, outside of the clinic, have you been involved in any larger efforts to respond to mental health aspects of the COVID pandemic?
Mm-hmm. Yeah, I have. One thing that I've been working on is a project with some colleagues of mine at Duke. So something that I use a lot with the patients that I work with at my clinic, it's called the, it's got a really cognitive behavioral treatment that essentially promotes skill building related to emotion regulation and distress tolerance. And I started thinking that, you know, two really important lessons that we teach patients with the unified protocol is one, that emotions are our allies and we need them to respond to any sort of problem we're faced with. They provide us with important information. But then also in the context of this treatment, we talk about how to notice when our emotions are becoming overwhelming and we're not responding in adaptive ways to them. And my colleagues and I thought, you know, this is really important right now. On the one hand, we're all needing to be anxious and fearful, right? Because these are the things that are driving us to wear PPE, to practice physical distancing. So on the one hand, it's sort of like we're communicating to people, or we're trying to communicate to people that anxiety is a good thing. Sadness is a good thing too. I think a lot of us are starting to reflect on things that we don't have right now. And it's sort of galvanizing us to want to reach out to people we haven't talked to in a while, or to really appreciate some of the things that maybe used to annoy us a little bit about being at work, and now we're missing our colleagues. So we created a very brief handout. It's sort of a psychoeducational handout based on the unified protocol. And we wanted to create something that was easily scalable. A lot of people don't have a lot of bandwidth right now, and I think they need brief targeted interventions. So we created something that was very brief, like I said, based on the unified protocol, that provides some psychoeducation about why emotions are our allies and we need them in the response to COVID. And then also providing some information on a specific mindfulness skill that people can use if their emotions are starting to get overwhelming and not as helpful for them. And we created it in a way that it could be used with patients, but also among our colleagues. And actually it got picked up by the Unified Protocol Institute. So they have that on their website now, and it's been shared at some other hospitals. I had someone reach out to me from Piedmont, actually. They wanted to share it with their colleagues. And then over at Duke as well, it's being disseminated. I've been involved with some stuff at the CDC. So the CDC has a large HIV surveillance system, the Medical Monitoring Project, and actually spent some time talking with leaders on their community advisory board to get a sense of kind of what folks in their communities are needing. These were community advisory board leaders from actually across the country. So I was hearing from them what their communities are struggling with, and had an opportunity to share resources with them too. And then all of us actually on this panel have been involved in a larger Grady initiative that we call Caring Communities. So we've been putting together different kinds of tip sheets for coping with a variety of, you know, different kinds of issues that may be coming up right now. We've also all been pitching in and providing support to staff and colleagues. So yeah, I don't know if anyone else wants to add anything, because like I said, everyone on this panel has been involved in Caring Communities at Grady. But yeah, those are some of the things that I've been involved in beyond Grady's Pont Center.
Thank you very much. Would anyone else like to add?
I've been involved in a study that is looking at consultation liaison practices within children's hospitals and how they've changed. So consultation liaison, for anybody who's not familiar, is just the practice of kind of seeing patients, consulting on patients in an inpatient setting and outpatient as well, but kind of providing support to staff and educating about different psychological and behavioral aspects of medical conditions. And so we're gonna, I think, submit that paper next week. I forgot which, I don't know if we decided which journal, but it's a few colleagues that are part of a national special interest group on consultation liaison. So hope some of you who are interested in pediatrics will read that once it's hopefully published.
Well, thank you, Dr. Agoston. That's very interesting, and thank you, Dr. Ammirati, for your response to the question. And I have you next on the list, Dr. Agoston. How do you think hospital-affiliated behavioral health practices have been affected compared to private practices not associated with a hospital system?
I mean, I think that some of the practices in private practice, there's a little bit less concern about like going into a waiting room and having other medical patients there who might be there because they think they have potential COVID symptoms, or, you know, I know most practices have been telling their patients, or medical practices have been telling their patients not to come to the clinic or to the ER, or you know, to be able to just call the hospital or clinic. But I think there's a little bit more I don't know, like a little bit more wariness of any practice that's associated with a hospital system, because there might be potential COVID patients there. That's not exactly true, because, you know, someone can have a illness and not know it and be spreading it to others. So I know a lot of behavioral health practices, if they're not doing telehealth, like if they're having to do emergency patient visits, they're definitely changing their waiting room practices, which is great. But I do think there's some of that additional anxiety if you're coming near a hospital because of that concern about are there COVID patients there that are symptomatic.
That's very true, Dr. Agoston. Thank you so much for answering that question. And next question is to Dr. Lamis. How do you expect suicidal thoughts, attempts, or deaths will be impacted by the COVID-19 pandemic, and why?
That's a very interesting question, and we really don't know the answer. In the past, there's been evidence that the 1918 influenza epidemic did increase suicide rates, as well as the more recent SARS epidemic in Hong Kong among older adults. However, COVID-19 is a completely different virus and includes more social distancing, which I think is really going to contribute to an increase in suicide risk and rates. I think mainly through the economic impact. We do know that suicide is increased during times of economic disparity, and also through just social isolation. Lack of connectedness is one of the biggest risk factors for suicide. And although people are connected through virtual ways and Zoom and stuff, they're not getting that face-to-face contact. So I'm worried that that's going to contribute to the suicide rate, just not having this connectedness to other people. I think also there's been a decrease of community and religious support, because people aren't able to go to religious events if they're religious, or other community events, which may increase the suicide risk. Earlier I talked about telehealth and how that impacts the way people are coming into the clinic or not coming into the clinic. However, it's also a barrier to treatment. So I think some people who may have child restrictions or aren't able to come into the clinic and may not be able to do Zoom appointments. So they are not getting the treatment they need and may become suicidal. I think general anxiety as well. And I'm also concerned about the increase in firearm purchases. In March was the largest spike in firearm purchases ever. So, you know, with this increase in firearms and people maybe not being cautious and putting gun locks on and just having more firearms accessible may increase lethal access to lethal means and thus suicide, because firearms is the leading cause of suicide deaths. So for all those reasons, I think that the suicide rate, we will see an increase, unfortunately. I also think there's some long-term consequences, such as what Dr. Agoston said earlier about child abuse is most likely increasing. We know that's a risk factor for suicide, as well as domestic violence in the home, because people are home more, so there's more most likely going to be an increase in domestic violence, which is a risk factor for suicide. And again, this economic issue is really, I think, you know, going to cause where we're going to see long term that, you know, years from now that the suicide rate will increase, but again, short term as well. So I'm hopeful that we don't see a spike in suicide, but you know, unfortunately, I think we may due to all those reasons.
Thank you, Dr. Nieb. Would anybody else on the panel like to add or comment? Well, great. We'll move on next to Dr. Palanci. What surprised you most about your program's response to the crisis?
Yeah, so for me, kind of a surprising experience has been actually kind of reflecting more on some of the ways we think about, you know, in both the programs that I'm involved in, I work mostly with people who have psychotic disorders, and there's a lot of, you know, I think we put a lot of barriers up between clinician and clients when working with those folks. And, you know, whether it's intentional or not, there's a lot of othering that happens that people with severe mental illness, so-called severe mental illness, experience. And so I think that for me, this, as we all know, I mean, this pandemic is by definition a shared experience, and both for me and for many others, it's caused an increase in anxiety and an increase in the experience of fear of the other, an increased sense of isolation and stagnation, and also, of course, a great deal of uncertainty. And I think, you know, these are feelings and experiences that many of our clients have been dealing with for sometimes in you know, situations for years. And so I think my experience of this pandemic has actually led to a deepened sense of empathy for what my clients go through. And that really kind of caught me off guard. It sort of like was like a light bulb went off. And so, yeah, that certainly caught me by surprise.
Thank you, Dr. Palanci. Would anybody else on the panel like to add or comment? I think that was very interesting information, and I think this pandemic has caught a lot of us off guard and has affected a lot of us in many of the same ways. I think it would be unusual if somebody wasn't experiencing some anxiety or some feelings of depression or frustration at this point. So I really appreciate that. Thank you. Now I'd like to go back for a little bit and do a couple or three group questions if we have time. I know we probably have some questions in the chat box from the audience that we'd like to get to too. So the next group question is, what is one positive thing that you believe will come from COVID-19 once it is under control and we can hopefully return to normal?
Without a doubt, the shift to all of us using more telehealth is going to be huge. And like Dr. Lamis was saying before, I think particularly for our patients at Grady, for whom just getting to the clinic can be a really difficult task. I think I mentioned before, our no-show rates are actually a bit lower too at Grady's infectious disease program. And I've had a number of patients comment to me that, you know, I can't believe you guys weren't doing this before. This is great. You know, I look forward to talking with you again. So I think the fact that we all had to sort of zoom into telehealth, granted, it brings some distress, right? Because we don't all always know everything we need to be thinking about, but we're learning as we go. And I think that that's going to be huge. And particularly with HIV, when it comes to retention and care, I think it's going to be a huge piece because we lose a lot of people in care because they just can't get to the clinic. It's just not for them. So I think it's going to really help us monitor how our patients are doing and ideally help us get closer to ending the HIV epidemic.
Thank you. Other members of the group?
Yeah, I think Dr. Ammirati hit the nail on the head. Telehealth is definitely a positive that's coming out of this, especially for our Grady low-income patients. Just accessibility to services has been incredible, and they're very thankful. And I hope it does continue for the patients that can't pay for transportation. So, and also among colleagues using Zoom, and this goes for professions outside of our healthcare profession, but you know, you start to realize that you can communicate through virtual ways, and you don't necessarily have to make every meeting in person. So I think that's another positive.
I agree. I agree. Anyone else like to comment on that?
I mean, I would echo those comments. I also think kind of in a more, I don't know, I think that this pandemic has required us to be more creative, more flexible, and I think that hopefully we'll be able to apply that to obstacles going forward, both new and old. And so for me, it leads to an increased sense of agency in the face of adversity. Like if we can kind of troubleshoot this and manage our way through such a huge challenge, what can't we, tackle next? And so that to me is going to be a huge positive. But I certainly agree. Increased being better at connecting with our clients, both literally, via telehealth or and then also just to reiterate my point from earlier of kind of being better at connecting with them on an interpersonal, emotional, empathic level. I think are more positives.
Great.
I think that, a lot of patients and clients that have been generally lacking transportation or lacking ability to come into the clinic will be served. So some of our underserved clients and patients are going to have a little bit more access. I know there are, concerns about maybe how, do you have to have a computer to be able to do telehealth? But a lot of the platforms, especially the ones that Children's is thinking of using, allows families to just be on their phone. Mm-hmm. So I think accessibility to services is going to increase, hopefully, if they allow some of the regulations that they that are approved for telehealth insurance coverage continue, which I'm not sure that will happen, but hopefully some of those will, at least the ones that are compliant with strict HIPAA regulations. I do think kind of in line with Justin that the flexibility and creativity of families has really shined during this time, and families have realized the value of family time, even though maybe most people want to are driving each other crazy. But I think there's a lot of kind of positive times that are coming from this unscheduled time and not having anywhere to go, and being creative about how to kind of entertain the family and kids. And so I think people learn those lessons and take that with them, even when things go, closer back to normal, maybe not, going back to normal completely, but I'm hoping that they'll continue those things.
Yes.
To follow up on that and to address Lindsay Greenwald's comment in the chat, the majority of our patients actually don't have a computer, our Grady patients, but they are able to log in by to Zoom on their phone. And from what I've seen, the majority do have a smartphone, and they're able to do a Zoom session or Zoom intake through their phone. So even if they don't necessarily have a computer with a camera, the phone has been effectively used.
And we're doing at Grady's infectious disease program, we also do a lot of simple phone calls. Again, there are some data that you lose. It's not ideal, but we are making adjustments. I ask my patients if do they have unlimited minutes? Like, can they only spend a certain amount of time on the phone? And like Dr. Palanci said, we're all having to be creative and adjust. I think another thing that's sort of exciting is I think we're all being forced to think about the essential elements of the treatments we deliver and how can we start to get even more efficient in terms of what we deliver. Because again, some of our patients cannot spend a full 45, 50, 60 minutes on the phone. And so we have to really start to think about, okay, what's the most important thing that I need to work with them on if I've only got 20 or 30 minutes with them?
Thank you all. Those are great comments. And the next question that we had is, one of the changes that you made to your program as a result of COVID-19, what do you hope persists after the pandemic resolves? I think you may have answered a lot of that in the first question, but if you have any other comments on that, let me know. Do you have any other comments on that at this point, or go ahead.
I mean, it's just a step further. I mean, I think we've talked a lot about sort of the telehealth technology, but I think, a big one component of our treatment is group programming, and that shift to virtual groups has been a positive support for our patients during this time. And I can imagine that, if payers allow for it, that's one thing that we definitely will include, that when hopefully sometime in the future, we're able to do some group programming in person, but also having this alternative route to group programming, I think will be something that I hope stays in place.
Thank you, Dr. Palanci. Dr. Ammirati?
Yeah, I actually hope that we retain focus on supporting our colleagues. On the one hand, my goal is not to become the therapist for all of my colleagues. At the same time, the emotional well-being of our primary care providers, it impacts how patient visits go. And I really like the fact that we're sort of approaching things in a more systemic way, thinking more broadly about how we can ultimately impact our patients, even indirectly. So I'm kind of hoping that we retain just doing things for our colleagues. And when I say we, I mean those of us who are providing behavioral health services at my clinic, that we continue to focus on doing whatever we can to support our colleagues, because I think it's important for our patients too.
Thank you.
Yeah, could I piggyback on that as well?
You can.
No, I just want to, I want to echo that comment. And also, I think one way I've conceptualized this is that we all know that there's been a lot of talk and literature about burnout for physicians and other healthcare providers.
Yeah.
That's been kind of an important topic over the last several years. And I really think this pandemic kind of put that burnout experience into overdrive for many of our colleagues, understandably so. especially those who are truly on the front lines. And so, yeah, I think I agree with Rachel that the more that I hope these supports that we've started to put in place can remain when this is all, when this is resolved, because I think it's really going to be an important way to keep our system healthy, and thus, ourselves and our patients healthier too.
Thank you, Dr. Palanci. I'm going to turn this over now to Ashley Singleton, our program manager. I believe she is going to be reading a couple questions to you from our chat box. So, Ashley?
Sure. Hello, everyone. So one of our first questions comes from an inpatient hospital social worker. She asks, how do we support patients and their families cope with post-traumatic stress, along with grief, loss, and death anxiety that they've experienced due to COVID-19?
I'm happy to chime in. So I think a couple of things are important to remember. Although post-traumatic stress is sort of common after a traumatic event occurs, and certainly given what's been going on with COVID, exposure to trauma is extremely possible right now. But it's really important for people when dealing with that to remember that it doesn't have to turn into post-traumatic stress disorder or any other disorder. And it's really important to continue as much as you can to seek out support, even if it's just over the phone, or even if you're sort of, talking from one balcony to another, to seek out support and really try to overcome the urge to avoid things that now seem scary that maybe didn't before. Because sometimes when it comes to dealing with post-traumatic stress, we want to just push away things that seem scary, even though normally we might not think they're scary, or we might want to avoid, going to a particular place that reminds us of something really difficult that we've witnessed there. And it's important to try to really overcome that urge to avoid and go to those places that we're kind of wanting to avoid now. Of course, assuming that they are in effect safe. And we can ask other people to get feedback to see what they think. Do you think this is safe? Okay. If you think it's safe, then maybe I will. I'm going to push myself, even though I'm feeling really anxious, to go ahead and face this thing that now is difficult since I experienced a traumatic event. So that's just a piece. I don't know if anyone else has anything to add, particularly about the grief piece. I think that was part of the question.
I mean, I assume just that inpatient social worker, the fact that she's still talking to these patients and, there for them, I think goes a long way. So don't underestimate your effectiveness in just being present with that patient. There's no magical thing that you can say to that patient that makes everything better, and don't feel like you have to make things better. It just sucks right now. I mean, it's an awful situation, and that's okay. People are experiencing losses. They are experiencing deaths in their family, a lot of anxiety, post-traumatic stress symptoms, trauma, and just having you there. And I think, they will be helped by that. Listening, validating that it's okay to feel anxious during this time. It's okay to feel grief. It's okay to feel loss. I think will really, really help them very much. So, don't overcomplicate it. Just, be present. I'm sure, the fact that you're even asking that question means that you're a very caring person, and that comes through to the patients.
Yeah. And that's actually a good point, Monica. Dr. Agoston.
Yeah. You call me Monica.
In the positions that we're in, care people, we very much want to take away someone's distress. And Dr. Agoston is right. It's a stressful time. This is where we're all at. And I actually think it's more helpful to, like Dr. Agoston was saying, to just let people be where they are. And not necessarily try to get them to a place of quickly being okay. We have to go through the hurt in order to be okay. And so just letting someone be where they are, even if it's not in the most happy place, is really important right now.
So we have several school nurses on the call this morning, and one school nurse asked a question. I anticipate stress levels and anxieties to be elevated among students as well as parents when schools reopen in the fall. What suggestions do you have for school nurses and other school staff members as we look to returning to school?
I guess I can start with that. So I think, so again, like I've said, parents and kids don't seem to be too worried about COVID itself. So I'm not sure if kids are going to be super anxious about being around their peers and trying to avoid them, although some of those behaviors that parents have appropriately taught their kids about social distancing. I have a neighbor whose little 2-year-old likes to stick out her arm and says 6 feet apart. Like, your arm is not 6 feet long, but that's the right idea. So some of those practices will continue, and I think just kind of doing what you can to kind of help kids feel safe or feel like they're doing what their parents wanted them to do, or talking explicitly like, yes, your parents said this to do this, but now we're doing this. And then just having the regular schedule. I think just having predictability for kids is really, really critical and goes a long, long way. So just, you know, outlining what the schedule is going to look like, is it going to be the same every day? Is it going to be different? But kind of let them, set the expectations for what things are going to be like and have a regular schedule. And I think that should just do enough to really help with stress. I think that's one of the biggest stressors during this time is having, even though the unscheduled time can be fun sometimes, it can be very stressful for parents especially, and for kids. They're not used to dealing with boredom, especially some of these kids who always have, they're running from one thing to another. And so I think having some regular schedule, I think, will be wonderful for them. And that's kind of built into the school day anyway. So I think, even though it might be a little bit of an adjustment, that's expected, and just to kind of roll with it and just tell the kids, you're going to be there for them. They can talk about things if they, need to with you. And then if you notice some kids that are experiencing pretty extreme distress, referring them to the school counselor would be helpful, or to other mental health services in the community if appropriate.
There's also been several resources that have been published that are available. I know of 1 or 2 books that make it easy to read to children. I'm not a child psychologist, but I have seen the books, and I think that's a way to really be upfront and truthful and honest with the children, because they're going to have a lot of questions, and having a effective way in an honest way to answer them is really important. And some of these resources we'll be happy to share with everyone. I think make it easier.
Okay, thank you all.
I just wanted to add one point that I'm seeing on the chat box, and before we close. And this question comes from one of our participants, and what considerations are being considered for the African American community in terms of health disparities in COVID?
Well, I can start. I think one important thing is our program serves a majority of minority individuals, and that we continue to accept referrals, we can continue to provide the services and get people the care that they need in the best way possible. We are collaborating with some other programs within Grady, including the Mobile Integrated Health Program, to help get people connected to medical services, even if they are hard to reach, or obviously with them not being able to come into the clinic in many instances. And we're also working on a program to distribute cloth masks to our clients for them to, if they're not able to acquire one on their own, to help keep them and their community safe as well. So none of these initiatives are directed specifically at the African American population, but our program does serve a majority minority individuals.
Yeah, we at Grady's Infectious Disease Program, I know we have some excellent case managers who are working overtime trying to address the needs of all our patients. So they are constantly scouring the internet, trying to find different funding opportunities to get people phones if they don't have phones, or get food to people, or emergency loans if people have been unable to work, or helping with childcare. So it's difficult for me to speak specifically to the funding opportunities out there and some of the specific programs, but our caseworkers I know are on it, and they are just constantly trying to find any new funding or program that's out there that can specifically help our patients who are faced with more health disparities.
And I think once hopefully this dies down, that we're going to need to encourage African American patients specifically, but also minority patients to come in to the health clinics, because unfortunately you can't diagnose HIV over Zoom or diabetes. So although staying connected, I think is going to be very important during this time through virtual means, but having patients come in the clinic for in-person evaluations and examinations to diagnose some health issues will be really important. But keeping them connected during this shelter-in-place stage is going to be critical.
Thank you, Dr. Lamis. And I just want to note that we're coming upon noon, and so our hour is ending. And I just wanted to thank the panel, especially for that interesting discussion. This has been, I think, has been helpful to all of us. It's been helpful to me. And we would like you to respond to the 3 brief poll questions that you will see on your screen, as your feedback will help us to improve our future webinars. It has been a pleasure to be your moderator today. If you would like further information about IPRCE, please contact us at the email address listed on the screen.